has spoken? All right, so I'm going to start I'm going to read out 3 names and in the order so that we can start it. Do know that if unelected officials come, I may have to usurp the order, but because we want to hear their voice. But I'd like to start with Dr. Torian Easterling.
1, 2, 3.
Torian, you didn't think you were going to be number 1. Dr. Easterling is the Assistant Commissioner of the Department of Health and Mental Hygiene, New York City's Department of Health. And we have the podium there. That way you can put your papers down. Oh, wait, one more thing. We want to do something to tape the button on there so we get everyone's voice.
The microphone has a very sensitive mute button, so I think if I tape it, we should be good.
And then after Dr. Torian Easterling, is Samantha Benton here?
Yes, I am.
All right, Samantha, then you're next on the lineup. And then Ali Shabaza. Okay, Dr. Easterling.
Good afternoon. Can you hear me? Okay. As was mentioned, my name is Dr. Torian Easterling. I'm the Assistant Commissioner for the Center for Health Equity's Brooklyn District Public Health Office at the New York City Department of Health, and I bring greetings from Commissioner Bassett. I was asked to give an account of the health status of the neighborhoods that Interfaith Medical Center serves and works to improve the health. And as many of you know, the Commissioner Bassett had released community health profiles late last year to provide valuable information on significant health issues facing New Yorkers and to serve as a public or a critical resource for improving health community by community. And so we use these community health profiles to get a better sense of what are the public health issues in our neighborhoods. We primarily serve the communities of Bedford-Stuyvesant, Bushwick, East New York, and Brownsville, as you have mentioned, North and Central Brooklyn, where we know these health inequities exist and social injustices persist. These communities have worked hard to make their neighborhoods healthier places to live, work, eat, and play, and pray. However, the gap between their health status and other residents in New York City is clear. These communities have been isolated not only from the city as a whole, but through increasing gentrification from Greater Brooklyn as well. And with many health inequities existing on the borough level, we know that this is a public health emergency. Violence continues to stand in the way of our community's best efforts to lead healthier lives. Brownsville has the highest injury assault rate in New York City, nearly 3 times that of Brooklyn and the city overall. Bedford-Stuyvesant and East New York are in the top 10. As such, it should come as no surprise that voids are being left and opportunities are lost in these communities through higher rates of incarceration. Brownsville, Bedford-Stuyvesant, and East New York are nearly all in the top 10. Brownsville ranked second with 348 per 100,000 adults ages 16 and older. Brooklyn overall has a rate of 96 per 100,000 adults, and the city is 93 per 100,000 adults ages 16 and older. We know communities with high rates of violence, poverty, and rent burden causes undue stress, contributing to substance abuse and mental health issues. We also know that in communities that lack access to affordable fresh foods and opportunities for physical activity, making the healthiest choice isn't always the easiest choice. It is also clear that we need to do more to support our families and young people. Brownsville ranks first in elementary school absenteeism, second in preterm birth, and 8th in teen birth. Bedford-Stuyvesant, East New York, and Bushwick all have higher rates than Brooklyn and City on all of these fronts. The biggest tragedy of all is what all of these inequities ultimately amount to: preventable and premature death. Additionally, our communities have some of the highest rates of infant mortality in the city. Brownsville and East New York are 4th and 5th, respectively. Our residents of these neighborhoods are people. These are not numbers. These health outcomes are not an indictment on these communities, but an indictment on all of us. And we must be up for the task of responding as a collective community. And so I would say that we have to be, as a collective, we can change the lives of our neighbors, and the current realities are unacceptable. Thank you.
Pass on the mic. She's coming. And Ali, you'll be next.
Good afternoon, everyone. Protocol already having been established, I was asked to speak on behalf of patient relations, more things that can be done here in the hospital. I need to say, I was born here in Brooklyn, New York. I was born in this hospital when it was St. John's. Having gone through PhD program here, what I would say is the staff has been quite professional. But there is something called constructive criticisms, and there is something that's called accountability. The patient relations department is well, but you know, I work for the police department. And in the police department, there's 3 letters: CPR, courtesy, professionalism, and respect. That should start and be also right here in Interfaith. Regardless of your rank, regardless of your title, regardless of your position, everyone in here is somebody and should be treated with the utmost respect. That's number 1. There is most definitely a need for folks to be in the emergency room, meaning new hires. It makes no sense. I've been there 2 to 3 hours waiting in the emergency room. And yes, presentation is important. If I come to the window, you don't know what my situation is. I don't need your attitude. Try some hello, how can I help you? How can I assist you? You may not, whether I look like I'm in pain or not, your job should be to expedite me, to get me through, to help me, to assist me. If this is what your passion or your desire or your care is, then you do it and you do it well. Because there are people out here looking for a job. I have a bunch of family members that need jobs, okay? So if you're going to do it and be a part of Interfaith and call yourself Interfaith with your family, then do your job. Keep the personal stuff when you come across the door still, be Interfaith. Leave that other stuff where it's at. The gift shop, like none others. The presentation, and I know I'm going around, but I have a point. Miss Harper, we came in, learned people's names. That's how well they've been treating me. Mr. Beauvais is the best, but the gift shop. Miss Harper presents herself. The way you see that gift shop is the way she presents herself. And that speaks volumes for people. You folk walk around here with you have like an attitude on your face. It don't hurt. You don't know some people you see today. Tomorrow we may not see each other on tomorrow. Tomorrow's not promised to anybody. Security. There's one security person. And the ER, because I've had to be here for my illness, like 7 times I've been brought to the ER. Like 7 times, being sick. And I've had good experiences and some bad. And when I had the bad, I know the chain of command. Where is patient relation? Where is Mr. Bouvet? Where is whoever the case may be? I'm a taxpayer. I'm a voter and I have something to say. So I'm going to say what needs to be said. With love, constructive criticism, but I'm saying all that to say there's a lot that can be done. There is a need for more to be done, but we can do it if we do it all together. That's the key word, unity and together, okay? I thank you for your time.
Thank you so much.
You're quite welcome.
No, this is
Oh, there we go. You're
here we
good.
go.
You're good.
My name is Ali Shabazz, and I was invited here. I'm a peer educator, and one of the things that I want to speak about is treatment. Right? There's not enough treatment to go around for the guys that want to get clean. I work in a field where individuals try to get clean, and there's not enough bed space. When they come to an emergency room like this one, they turned away and said there's not enough beds. Right, so therefore they left to get back on the street and do what they do. Me, myself, I'm a customer of the street. I'm a recovering addict with 22 and a half years clean.
Yes.
So I know how important it is for an individual to get tired of doing whatever it is that they're doing and to come someplace to seeking for help and the door get closed in their face. So when the door get closed in their face, they left to go back to where they go, right? I'm an advocate. I'm also a certified recovery peer advocate. I'm also currently taking the HIV worker certification, and this is the field that I've been in for the last 20 years. And I'm glad to be here for the simple fact so y'all can hear what I have to say. And not only to hear what